Ever thought about how your kidneys are doing today? And no, I'm not trying to sell you a kidney transplant. I hear they cost an arm and a leg, and last time I checked, those aren't the organs we're dealing with here. Not a typical question you'd ask yourself, is it? Well, maybe it should be. We often overlook the importance of kidney health, yet it's a rising concern globally. In Nigeria, the statistics are alarming. Each year, thousands of people face the life-altering diagnosis of kidney failure. Our kidneys are silent heroes working tirelessly to filter waste from our bodies. But like any hero, they have their kryptonite. One of the most common yet overlooked villains? Our lifestyle. Yes, the way we live our everyday lives plays a significant role in our kidney. From what we eat to how much we exercise, from our water intake to our alcohol consumption, every choice matters. Our kidneys aren't just a part of us, they're a reflection of us. They mirror our choices, our habits, and lifestyle. Now let's take a look at some of the lifestyles that can lead to kidney failure. Do you know the saying, "You are what you eat"? Well, your kidneys might agree. Imagine your kidneys as a pair of diligent workers, tirelessly sifting through your blood, filtering out waste, and maintaining a delicate balance of salts, fluids, and minerals. Now think about what happens when you burden these hard-working organs with an unhealthy diet, excessive alcohol, lack of exercise, or an overuse of medication. It's like asking them to work overtime, every day, without a break. That's the lifestyle trap, my friends, and it's a slippery slope towards kidney failure. Let's start with diet. Picture your plate. Is it loaded with salty, fatty, or sugary foods? These don't just expand your waistline, they also put a strain on your kidneys. High sodium levels can cause high blood pressure, a leading cause of kidney disease. Fatty and sugary foods contribute to diabetes, another major culprit. And don't let's start on those processed foods with their hidden, unhealthy ingredients. Then there's the alcohol factor. A glass of wine or a pint of beer might be okay now and then, but regular heavy drinking? That's a whole different story. It can cause high blood pressure, liver disease, and yes, kidney damage. Next up, physical activity, or rather the lack thereof. A sedentary lifestyle can lead to obesity, high blood pressure, and diabetes, each of which can damage your kidneys. So if your idea of a workout is lifting the remote, you might want to rethink your exercise routine. Lastly, the pill problem. Over-the-counter and prescription medications can be lifesavers, no doubt about it. But popping pills like candy, that's not just bad for your liver, it's bad for your kidneys too. Every medication you take ends up in your kidneys, and too much can overload them. So there you have it. 4 lifestyle choices that can lead to kidney failure. But don't despair. It's not all doom and gloom. Now that we know the risks, let's delve into how we can prevent kidney failure. Did you know that what you eat can either help or harm your kidneys? It's not a rhetorical question, it's an essential fact we need to be aware of for our well-being. Our diet plays a pivotal role in maintaining our kidney health. It's akin to fuel for a car. If we use the wrong fuel, it can cause significant problems, and the same goes for our kidneys. Let's talk about the foods that can be harmful to our kidneys. First on the list is processed foods. They are often high in sodium, phosphorus, and other additives which can put a strain on our kidneys. Then we have red meat. While it's a good source of protein, it also produces a significant amount of waste, which can be taxing on the kidneys if consumed in excess. Sweets and sugary drinks are also culprits. They can lead to obesity and diabetes, 2 conditions that increase the risk of kidney disease. And let's not forget alcohol. Consuming it in large quantities can cause kidney damage over time. Now on to the foods that are good for our kidneys. Fresh fruits and vegetables are packed full of antioxidants that help keep our kidneys healthy. Fish and lean meats provide us with the protein we need without overtaxing our kidneys. Whole grains, legumes, and low-fat dairy products also play a part in a kidney-friendly diet. But remember, moderation is key. Consuming too much of even the healthiest foods can still lead to problems. It's all about balance. Also, it's crucial to stay hydrated, but not overly so. Drinking too much water can also put a strain on your kidneys. Aim for about 8 glasses of water a day, but adjust according to your body's needs and your doctor's advice. In conclusion, maintaining a balanced diet is not just about keeping our waistlines in check. It's also about ensuring our kidneys, those unsung heroes that filter out toxins from our bodies, are kept in optimal health. Remember, your diet can make or break your kidney health. So let's make wise choices for the sake of our kidneys and overall well-being. Don't feel like hitting the gym? Your kidneys might want you to reconsider. Regular exercise is much more than just a way to keep your waistline in check. It's a crucial part of maintaining overall health. and that includes the well-being of your kidneys. When you engage in physical activity, you're not just burning calories, you're also improving blood circulation, reducing blood pressure, and controlling levels of fats and sugars in your blood. All of these factors have a direct impact on your kidney health. Whether it's a brisk walk in the park, a quick swim, or a heart-pounding session at the gym, every bit of exercise counts. But remember, it's not about pushing your body to its limits every single time. The key is consistency. So find a form of exercise that you enjoy and make it a part of your daily routine. Now let's talk about medication. While the right medication can be a lifesaver, misuse or overuse can be a silent threat to your kidneys. This is especially true for over-the-counter painkillers. Yes, they may ease your headache or soothe that annoying backache, but frequent and prolonged use can cause serious damage to your kidneys. It's also important to note the dangers of self-medication. It's a risky habit that can lead to incorrect dosage, dangerous drug interactions, and even drug dependency. Always remember, your doctor knows best. They can provide you with the right medication at the right dosage for the right duration. So, the next time you're tempted to pop a pill without a doctor's prescription, or when you feel like skipping your workout, think about your kidneys. They're quietly working behind the scenes, cleaning your blood, managing your body's fluid levels, and performing many other vital functions. They deserve your care and attention. Exercise and responsible use of medication are your kidneys' best friends. Enjoy a drink or two? Your kidneys might not feel the same way. Now let's not be party poopers here, but it's important to understand the relationship between alcohol and your kidneys. You see, alcohol is like that friend who's fun at parties but can cause havoc if they overstay their welcome. When we drink more than our kidneys can handle, they have to work overtime to filter out the toxins. This can lead to high blood pressure, a leading cause of kidney disease. Plus, heavy drinking can cause a direct injury to the kidneys. Kind of like how a rowdy party can wreck a perfectly good living room. But here's the good news. Moderation is your secret weapon. By enjoying alcohol responsibly, you can keep the party going without stressing your kidneys. So, the next time you reach for that bottle, remember your kidneys. They're working hard to keep you healthy. Moderation in alcohol consumption is key for your kidney health. So, ready to make a change for your kidneys? The big question is, are you ready to take the reins of your health and steer it in the right direction? It's not always about the grand gestures or the drastic changes. Often it's the small, consistent, everyday choices that make the biggest difference. Picture this. Of reaching for that soda, you opt for a glass of water. Not only does it quench your thirst, but it also helps flush out toxins from your body, giving your kidneys an easier time. And remember, it's not just about drinking more water. It's about choosing water over those sugary or alcoholic beverages that can be a nightmare for your kidneys. Now let's talk about salt. It's in almost everything we eat, and while it can make our meals taste better, too much of it is a one-way ticket to high blood pressure-ville, a place your kidneys would rather not visit. So how about we start reading those food labels and choose products with less sodium? Or better yet, let's try using herbs and spices to season our food instead. And of course, we can't forget about the importance of regular checkups. Our kidneys are silent workers. They don't complain, they don't make a fuss. But when they're struggling, they need us to step up and get them the help they need. Regular checkups can catch kidney problems early, when they're more manageable. Let's not forget, our kidneys are like the silent heroes of our bodies, working tirelessly to keep us healthy. They deserve our attention and care. Small changes in our lifestyle can make a big difference in their health. So, are you ready to take action? To drink more water, reduce your salt intake, and get regular checkups? It might not be the easiest path, but it's definitely the healthier one. Remember, your kidneys are counting on you. Make the right choices for them today. And don't forget to subscribe to our YouTube channel for more interesting health videos.